Welcome to Arkana.
Hi, good morning. Go on in.
Hello, welcome. Thanks for stopping by Arkana Laboratories. My name is Chris Larson. I'm a renal pathologist and the executive director here at Arkana Labs. Arkana is a highly specialized laboratory focused in the area of neuromuscular disease and in kidney diagnostics. Every day, biopsies show up here from all across the country. These are biopsies that were performed yesterday, and by the end of the day, today, we will issue a diagnosis so that the clinician can know how to treat their patient and what's going on. How do we go about doing this? How do we get this done in a day? Well, that's what we want to show you. So let's head to the lab and let Stephanie show us where the magic happens.
Welcome to the lab. Same-day results require a lot of duplication of equipment and a lot of people that know how to use that equipment. Grossing takes into account what we receive while a physician triages the cases for special stains and clinical history. So don't forget to send us your history. While we have specialists in each department, all of our techs are cross-trained in 3 departments: light microscopy, immunofluorescence, and electron microscopy. Let's go meet the light team. In light microscopy, we utilize rapid microwave processing. We cut a total of 13 slides, put 2 sections on each slide at 3 microns. In IF, we still do all of our stains by hand. We find that people are still faster than machines. In IHC, there's always a long list of things to do here. Our physicians are always coming up with new stains. Steve, what's the latest?
The latest is the EXT1 that we have just validated.
That sounds great. Let's head to electron microscopy. Electron microscopy is the most intricate and time-consuming of all. It takes about a year for a person to become proficient. Our serology department is membranous focused. We primarily do testing for PLA2R, thrombospondin, and we also do testing for ABA. Now let's hand it over to Dr. Hahn in the molecular lab.
We use various modern molecular techniques to try and aid in the diagnosis of various kidney diseases. For example, we do quantitative PCR looking at APOL1 genotypes. Anything that we find over here, we can always confirm doing Sanger sequencing, and that's true for other techniques that we use. We also use various next-generation sequencing platforms to look at exonic variations in genes of more complex diseases, for example, Alport syndrome and FSGS. And again, any of those results we can confirm on Sanger sequencing. And in these ways, we can provide molecular techniques to aid in the nephropathologists here in the diagnosis of kidney diseases at Arkana Labs.
I'm Alejandro. I'm one of the renal pathologists here at Arkana. As you've seen so far, the mornings at Arkana are really busy, but most of the action really happens in the lab. On the physician side, things are a little bit more quiet. That's why we take advantage of this time to do mostly academic work. Now, at 10 a.m. every morning, we all meet in this room. We have a daily case conference where we bring either challenging, interesting, or cases that can generate some sort of discussion from the day before. As you can see, we have a really nice setup with a multi-headed scope. So one of us drives while the others look at the case, but we can also take advantage of this setup to review cases with our fellows or with our visitors. At around 11 a.m., we usually finish our conference. If we need to have a quick meeting or touch base on anything, we can take advantage of this common area. Afterwards, we go back to our offices, and at that point, our cases are starting to come out. So we review the case, and then we proceed to probably the most important part of our day, which is when we talk to the nephrologist. Our conversations are centered a lot on the clinical aspect of the patient. We review laboratory data, treatment, prognosis, clinical trials, etc. While we are not in the same facility, the nephrologists have the opportunity to review the pathology images through our app or through the website.
As you can see, Arkana Laboratories is a fun and exciting place to be, but ultimately we want to be known for what we care the most about, and that is improving patient care. We do this through issuing accurate diagnoses as rapidly as possible, as well as advancing understanding of these diseases we diagnose through education and research. I hope you enjoyed your time here today.